Welcome, everyone. How many of you are familiar with our Place Matters initiative? Well, today we're going to talk about advancing health equity and improving community conditions that matter for health. But I wanted to be clear that we're going to just spark this discussion through the particular lens of our Place Matters initiative. And we thought we'd just set the stage by highlighting 10 important things that we've learned from our latest local data. So this map shows that place matters greatly for health in Alameda County, and ill health concentrates in certain parts. A main reason why place matters so much is that neighborhood poverty is so closely related to health outcomes and life chances. With each step up in neighborhood poverty, life expectancy goes down. Health inequities, they didn't happen overnight, and they didn't happen just by chance. We have a long history of discriminatory policies and practices that have concentrated people of color, poverty, and ill health in certain places. And in Alameda County, Blacks and Latinos continue to be much more likely than Asians and whites to live in high poverty neighborhoods. There are many different resources that we all need in order to be healthy. And here you can see some of the different resources and conditions that vary across neighborhoods in our county. Residents of high poverty, disinvested neighborhoods, they're less likely to live in conditions that support good health. For example, compared to people living in affluent neighborhoods of Alameda County, residents of very high poverty neighborhoods have reduced access to income and employment, face greater barriers to school success, are more vulnerable to unhealthy housing conditions, at increased risk of violence and mass incarceration, more exposed to pollution hazards, and more likely to depend on public transportation to get to places that matter for their health. So today what we're going to try to do is to challenge ourselves to consider, how can we improve these inequitable community conditions that produce poor health? And we're just going to begin to explore this by talking about our local Place Matters initiative. So I'm going to turn over the mic to Alex Desatel, who has pretty much been at the helm of this work. Let's welcome her with a big round of applause.
Thank you, everyone. Good afternoon. As Tammy said, I'm Alex Desatel. I work here in the Public Health Department in the Office of the Director. And as she said, this is just one of the things that the Public Health Department is engaging in around advancing health equity and addressing all of the conditions that or the health outcomes that you saw that are really being driven by inequitable conditions in our communities. And I know that this is building off of a lunchtime learning session that we had not too long ago. And this is clear, Place Matters is not everything that we're doing, and we do want to have more forums in which we explore all of the different important work to advancing health equity. We're rushing this one because I'm leaving. Today is actually my last day with the Public Health Department, and so it was an opportunity to fit this in before I head out the door. But the work's not going anywhere, and in fact, people working on Place Matters, can you raise your hand? And there's a lot more people in our department working on this, so it's going to just continue. I just have the privilege of talking about it one last time, my parting opportunity to talk about this work that I care about so much. like I said, all of this work is, I'm just talking about it, but it's on behalf of a really excellent team that we have here at the Public Health Department. And the policy work that I'm talking about is part of our Public Health Department's approach to achieving health equity. So for people who can remember back to 2006 or 7, we did a strategic planning process where we identified strategic directions, and among those was policy. And also we found that essential to achieving health equity would be institutional change and community collaboration and partnership. And so while Place Matters is primarily focused on policy and policy change, our process really attends to the other parts of this triangle here, which is institutional change and community collaboration and partnership. And so I'll be highlighting a little bit of the training that we do, as well as all of the amazing partnerships that we work with in the public health field and across disciplines in government and with the community. And of course, all of this is in service of advancing the outcomes and the success of our programs and amazing programs and services that we already have here in public health. And really what we see as the policy work that we're doing is making sure that there's the optimal conditions in which to provide our services. So for instance, if you're going out into a house in West Oakland and you're working with a child who has asthma, there's going to be only so far you can go if every 10 minutes there's a dirty truck going down out by the house, right? And so we're really trying to figure out what can we do at this macro systems level to make sure that if you're working with someone to improve their health outcomes, that the whole environment also supports that as well. Okay, so Place Matters, like I said, it works on policy. We promote health equity through community-centered local policy and systems change in a lot of areas: criminal justice, economics, education, housing, land use, and transportation. They're just all important, and we couldn't choose, so we decided to do them all. And Place Matters was, well, I'll get into this in just a few seconds, but it's part of a larger national initiative through the Joint Center for Political and Economic Studies that was launched in 2006, and I'll talk a little bit about that history in just a moment. So I'm going to talk next just about a few key highlights so that you know that this work actually does have an impact before I go into all the other stuff. But this year I just want to celebrate that our department invested in two more permanent positions. So that brings us up to just a handful, my position and 2 program specialist positions, really full-time dedicated to this work. And then we have people who are parts of their time is contributing to advancing the Place Matters work, and then some communications capacity. So that's just really exciting, and it shows that the department is committed to supporting this approach to achieving health equity, along with all of the other things that we're working on in the department. So in terms of how some of the stuff that we've been able to achieve, we have a system through which we respond to issues that come up. So a community group or a government agency might call us and say, this issue is happening, I think it has impacts for health, I would like you to do some analysis and make recommendations. So we field those requests on, I would say, I think 3 came in yesterday, so it varies, but I would say on average at least 1 a week if I were, our database was not functioning for a little while, so we're getting it back up to speed, but if I could go through that, I think it's more around like 1.5 to 2 a week new requests that are generated to coming to us. And so some of them are quite simple and some of them are more difficult and result in longer term work. One that's resulted in long-term work is around the Oakland Army Base redevelopment. There's a huge redevelopment process happening over on the Army Base that's right next to the port. You can kind of see it when you're getting on the Bay Bridge going towards San Francisco. And there was a lot of work being done to make sure that good jobs were going to be created through that project. But there was a gap in that, you know, when you're expanding the port, we're talking about more trucks, more trains, more potential health risks in terms of environmental exposures. And so we were asked to look at what are some of the implications, and we worked with our community partners and the regulatory agencies to start figuring out, okay, what can we do here? And at first the City of Oakland was understandably very focused on just getting the project done, but not as focused on making sure that it was going to be done in a way that protected community health, air quality and community health. And so we went through the environmental impact report and found the areas where the developer was supposed to be doing some work around air quality mitigation. And we worked with our partners to apply the appropriate pressure on behalf of the community residents that we represent and with them to make sure that as this project moved forward, there was going to be air quality monitoring and on a continuous basis through a multi-stakeholder group. So that's something that without us coming to the table, having had the capacity to respond to this emerging issue, just would not have happened. So that's a very exciting example. I'm going to skip down to we've been really providing much more. So this work started in 2006, and we were just getting started and trying to understand the issues. What I'm really excited to report now is that, and it was a lot of us, of the public health staff, going out there to understand things. What I'm really excited to report now is that we're in the position of different agencies and groups coming to us on a regular basis, asking us to play a very technical role in their work. So we've attained a certain level of credibility, and we've been able to make it so that people in the environment understand that we have a role that we can play at the table that's mutually beneficial, that's in the interest of everybody. And so we participate on a lot of advisory boards and so forth. We have lots of non-traditional partnerships. In fact, we're going to be designing and launching a product that I'll be talking about soon, small dollar loan product with the Federal Reserve Bank. So that's or in partnership with them. They're helping us sponsor the planning process. So that's a really good example of new partnerships. And we've been getting some national attention on our department, which is really exciting. We were highlighted in the public health reports as the CDC journal, and it really highlighted our work as a best practice for moving towards health equity. And then we do sessions like this and so forth. Okay, so how did we get started? We started by a call to action through the Joint Center for Political Economic Studies in 2006. They reached out to Supervisor Keith Carson and said, we see that there's these inequities, we know that policy has something to do with it, and we want to recruit teams to do something about it. And that was about the extent of the guidance that they gave. And so we came together, and I was actually just joining the department at that time, and figured out, our leadership defined several areas that they wanted us to look in, the areas that we've ended up focused on, and thought about, okay, so what's going on in these areas and what can we do? And we basically did what public health people do and did a needs assessment. So what's going on? Collect the data. What are the differences? And who has housing problems? What are they? What populations? How are these linked to health? We did all of that very initial learning. This is before we had our life and death report and a lot of the kind of work that now guides all of us. This was just at the very beginning of that. And as we reached out to our partners to understand the issues, they would say, oh, it's great that you want to understand them, but actually we need you to act now. We need you to come to the city council meeting and talk about why it's important to do this for community health. And so we went very quickly from kind of trying to understand the issues and collect information to analyzing the health impacts and making recommendations to different decision-making bodies. So that was a lot to manage. It took us a while to kind of figure out, okay, we could be completely consumed with just constantly being in this reactive mode, but we would never get to maybe what was the most important or where we're going to have the deepest impact, get the biggest bang for our investment. And so we also we weren't doing anything to develop our department's capacity to respond to this. It was just kind of siloed, not connected to our programs and services. So how can we figure out a way to make our work more proactive and more connected to the existing work of the department, which is when we went through a planning process that resulted in the launch of our different work groups. We have one for each of our policy areas. Well, land use and transportation are combined, but we have one for each of the policy areas where we worked with, there was a general call to action and all staff were invited to join the work groups. And we worked to really figure out what are the issues that are coming up for the staff who are represented in the work groups, programs and services, and how could we think about interventions that would address those issues. And where there wasn't so much of a connection, and we also just talked to experts to figure out what are just some experts, meaning people who either had academic or professional experience and community members dealing with the issues in each one of our policy areas to figure out what are the priorities and how should we be moving forward. So after a process of doing that, we launched a community engagement process where we further did some analysis of the issues and looked at what should we prioritize, and ultimately launched a policy agenda, which we've been advanced in 2010, which we've been working on since then, in addition to responding to the issues like I told you about. Here is our process. It was formally adopted only last year, but this is essentially the process we've been working with to respond to local issues. And I think it's really important for staff. Any one of us can basically be an avenue into this work. So if there's someone that you're working with who is talking about an issue, a decision, it has to be kind of like a policy, a plan, or a project, something that exists. We know that, for instance, housing is an issue in general, but unless there's a proposal of how to fix that, or there's a proposal that's going to make it worse, where there's nothing we can really tie into. But if there is some such proposal and you know about that, you can contact any of our staff and we'll provide you with analysis that would help make recommendations on how that proposal, plan, project should move forward. And the department has approved protocols for that. So here's the protocols. We've developed screening criteria. The public health department, we submit recommendations to the health officer and director. They approval. We complete the analysis. We do the action and then document it. And as part of the action, we're starting to be more consistent about notifying the board of supervisors. Okay, so now I'm just going to move into each one of our policy areas and talk a little bit about the work that we've been doing, what our current focus is, and what some of our successes have been, and what our hopes are, our plans are for the coming year. So this is basically, Tammy already kind of went through the connections between health and the different areas that we're covering. This is just a quick kind of pathway diagram. So, so just as one pathway here, being involved in the criminal justice system can limit your health opportunities in terms of your ability to access really important health promoting resources like a job or housing, things that are very essential to having good health outcomes. So the focus of our criminal justice work group, and in fact we've actually been unable to meet so consistently as a work group because we've been doing such a heavy lift on this project. But the plans are in the coming year to hopefully revitalize our work group as a consistent place where people can come together to meet on these issues. But anyways, so the focus is really the cycle of incarceration and reincarceration. We know that a lot of times once people get into the criminal justice system, they get reincarcerated over and over and over again. And so we were able to work with Alex Briscoe, the Healthcare Services Agency Director, to get $2 million through the Community Corrections Partnership. This is AB 109 money allocated to us to run a program, an innovations and reentry program, where we're working with community-based organizations on interventions targeted at reducing and eliminating recidivism. And it's really exciting because if you were to look at how the larger pot of this money is distributed, it's really focused on corrections. And so this is an opportunity for us to work with community-based partners to think about what are some of the alternative ways to interrupt the cycle of reincarceration. And so we were really excited to say that we worked through in a very through a participatory process. So, we received the money and we got to do all the planning about how are we going to distribute these funds, and we prioritized a very participatory process. We invited our partners in and had a great planning work group and funding board that made decisions about our grantees, and we selected 9 grantees to work with, and their interventions are they're just extremely varied. So there's one that's a doula training program working with women who were previously incarcerated, become doulas, to then work with women who are incarcerated and going to have babies. And that's an extremely exciting and innovative approach. And then another one that's looking at access to employment and how to bring the business community around to making sure that it's not unfairly excluding people just because they have a conviction, with the ultimate hope to pass policy at a county-wide level that will prevent private businesses from excluding people just based on their conviction records. And another exciting part of this is that we're really, the department prioritized results-based accountability, and so we're really able to work with our grantees to make sure that they're integrating that thinking into their projects as they measure their outcomes and their impact. And we're hoping that, well, let me move to the next one. So like I said, we have partners from across the county, a lot of different agencies, and then community groups. And one of the things that we're hoping to do is by really working with our grantees to ensure that their success and measure their impact, that we're able to secure support for another round of funding. So I wanted to pause here and ask if there are other people working on criminal justice issues in the county, and if there's anything that you would like to share about what you're doing, or some thoughts that you have or ideas that you have around this issue area that we should be tracking, or ways that we can collaborate.
Or if you just have questions about the criminal justice work.
And
So I do have a question.
there's a microphone, wait, before you start. I just don't know where it is. Oh, okay.
Oh, I can hear you.
Oh, it's for the,
Oh,
sorry, no, it's for the recording.
okay. So you talked about barriers to employment. I was going to ask, what does that look like?
Okay.
And you mentioned that in terms of private industry, but if I remember correctly, there's also some barriers even in terms of employment with public organizations, and so I was wondering if you guys are also working with public organizations, and then, yeah, what does that look like?
Yeah.
I mean, in terms of, you know, not really holding it against people if they have a record.
Right, that's a great question.
Working with the different organizations.
Well, I'm proud to say that here in Alameda County, we've actually banned the box. So for people who don't know what that means is that when you have an application, sometimes for places where they haven't banned the box, it'll ask you if you have a conviction on one of the very first questions that they ask about you. Do you have a conviction? So it's one of the first things besides your name and maybe your race, ethnicity, although I think a lot of times they don't ask that on the initial job application, that someone's going to know about you, that you have a conviction. Now, the conviction might be petty possession from when you were 15, or, you know, it might be something around a driving conviction or something like that, something not at all to do with your employment history and something that you've already served your time on. So in Alameda County, we've banned the box. We don't ask about that right up front in the application process, and some of the other jurisdictions in Alameda County have as well. And so it means that basically you're not going to get screened out right away based on that conviction. Now, down the line, you might be asked, and there are certain kinds of, like, for instance, if you were convicted for something dealing with theft, if you're going into a job where you're handling money, they'd be able to look at that kind of conviction. And most jobs still do a background search, but this approach makes it so that you don't do that until you've gone through all of the other parts of the application process. And so an employer knows so many more things about you and why you'd be good for the job before they know that. And so they're less likely to exclude you just based on the fact that you have a conviction. And then usually, along with this kind of fair chance employment, there's rules about the fact that you cannot discriminate against somebody just because they have a conviction. And so if you've gotten so far, that's actually national law already, but it's hard to tell whether or not you were discriminated against because of your conviction if you don't even make it through the first round. But if you've made it all the way and it seems like you would get the job and then suddenly because of your background check you don't, you're legally not allowed to, as far as I understand it, I'm not an expert in this field, discriminate against a person simply because of their conviction unless it's related to the job responsibilities that you're going to be carrying out. And so if you get to the very last round and then you find that you're not accepted because of that conviction and it was unrelated to your job responsibilities, it's easier for you to sue. Yes.
First of all, I just want to thank you for your service. It sounds like it's been really, you've really launched a great project. And my question is about mental health. Is there a mental health component to the Place Matters? For example, in the criminal justice work, helping people who have served a lot of time to manage their emotions better, or mindfulness skills, that sort of thing.
Yeah, that's a great question. You're going to make me cry. Can you turn off the videotape? That's a great question, and actually Annalise, which is one of our leaders on this project right here, if you want to raise your hand, she can talk to you a lot more about this, but she and I were just talking about how some of the grantees are integrating two approaches. One is around like kind of more of a wraparound services, case management type approach, and another is mentoring, and like some of what that does in terms of helping someone connect to someone who's been through the same experience, and kind of, it's not as much, counseling, but it's attending to the psychological side of navigating this really challenging entry into the community. And so it'll be really interesting to look at the differences in outcomes with the grantees that are integrating those types of approaches and those that aren't. And I'm sure that some also have a more intensive counseling part of it. I just don't know them offhand. Yeah. Yes. Okay. Okay, so I'm gonna, unless there's other burning questions, I'm gonna keep moving. Okay. Okay, so employment and health, it's pretty clear cut. You need a job, you need money to be healthy, because we don't live in a total communal society where everything is shared and you get things just because you need them. We have to buy things, we have to buy our food, our housing, everything like that, and if you don't have access to employment, you're not going to be healthy, and it's going to be much harder to have opportunities to be healthy. And also economic stress. There's more and more research showing that economic stress has a particular implication for health and your mental well-being. That it's a much more difficult stress to handle than many other kinds of stress. Okay, so when we're talking about economics, it's like, where do you begin? There's so many different things that need to happen when it comes to improving, to dealing with poverty in Alameda County and the country. The little sliver that we've picked off is access to credit. So basically, a lot of people either have no credit or bad credit, and so they're unable to get credit cards or loans, which is, for better or worse, the way that a lot of families are able to make ends meet from month to month when between paychecks, basically. And so what do people do? Go to the alternative market, which is very, very predatory. You have your payday lenders, your check cashers, your pawn shops, things like that. And they charge extremely high interest rates, funneling much needed resources away from people who are already struggling. And so what we're working on trying to do is use county funds as a loan loss reserve for a small dollar loan program. So these are loans between $500 and $1,000 that would help, that are short term, over 6 months, that would help people basically bridge these times where they having a cash flow problem. And one of the great things that we're hoping to see in this program is that not only would we be providing this loan, which some organizations do, but we're trying to work out a system for reporting to the credit bureau. It's actually expensive to report to the credit bureau. So even if you are making your payments on time, if no one's reporting it, it does nothing for your credit. And so what we want to do is make sure that these things are being reported to the credit bureau, so people's credit scores are improving, so eventually people can move into the mainstream financial market. We're really excited to be moving this forward. We're working with the Alameda County Community Asset Network. Hopefully Ashley's here from there if you all are really interested in this area, held by Urban Strategies Council, the San Francisco Federal Reserve, and Social Services Agency, as well as we've worked closely with Family Health Services on our prosperity project. And I failed to mention the fact that what we're also hoping to do is really tie this loan product to the needs of the people in our programs and services in the county. So if someone's encountering working with a client who needs something like this, that we'd have direct way to getting people in these loans. And so what we're hoping to do is we're just at the beginning phases of the planning process, but we're hoping to complete it within 6 months and launch the product. And we're hoping that we would, depending on the size of the loans and how many, our loan loss rate basically, so how many do people default on, we're hoping that it would be between 1,000 and 2,000 loans. And I didn't say, but obviously we're trying to do the loans at the very lowest interest rate possible for the financial institutions not to lose money. But we're not going to, this is not like we're trying to launch our own predatory lending product, lest that goes without saying. Okay. Education, sorry. Any questions here, or people who want to add anything or have ideas of how we could be partnering? Yes?
I'm just curious, is there an education component to that so that people understand better how the credits, how those credit bureaus, financial credit bureaus work? Because yeah, so that they understand what causes their credit to go down.
Right. Right, so like going to a payday lender, even if you make your payday loan payments on time, just that counts against you in terms of your credit score. Right, and a lot of people don't know that. So a couple of answers to that. One is we're really excited, and actually this project was just awarded by the California Asset Building. Do you remember the name of it? California Coalition for Asset Building, yeah. The Savvy Consumer Toolkit, which we were able to create in partnership with Urban Strategies Council through our Prosperity Project, does a lot of that education. So it's like, you know, it's basically talks people through how to be a savvy consumer of these products, with the recognition that unfortunately, when it comes to a lot of them, there aren't any other choices. So a lot of times people are unfortunately making the best choice they can, given that there's not options. And so that's where our new product comes in, that we're trying to expand the number of options going to people. And so then in terms of our product, we're hoping to work with financial institutions that will, as they make the loan, also offer some of that financial coaching services. And I know that in our family health services, through some of our home visiting programs, there is some training going on of staff on using the Savvy Consumer Toolkit, which goes through, I think, I forget, 11 different products or something like that.
Yeah, 8 right now, but we have identified up to 23 different products, so we're working on adding a few more this year.
So everything from rent to own to payday loan lenders, all of these things to look at how do you make a choice about what's going to be the best for you and not count against you.
I asked that just because my friend was looking for a car, and she was shopping to get the best price. And every time she went to a car dealer and had her credit checked, she got points knocked off her credit.
Oh, right.
So if you're trying to be,
right,
frugal and get the best price, you're actually dropping your credit. So I mean, that just seems wrong.
Yeah. Yeah, and hopefully some of these things start to change with the Consumer Protection Bureau, but it's wrong. This whole area is wrong. And we're hoping that we want to launch this product, but that's not the end of it. And what we really want to do, part of that is kind of forcing systems change among our financial partners. And after a couple years of us providing the loan loss reserve, we're hoping that they do it without us providing the loan loss reserve. And then, the next step would be looking at something else to tick off, and maybe working with Ledge Council at the federal level, we can just overhaul the whole system. Pam, what do you say? I think I saw Barbara and then Amy. Okay.
Just a quick question, if you know of anything going on around living wage or raising minimum wage locally versus waiting for national.
Right. Well, I mean, what happened in Santa Clara County, in San Jose, which was really exciting. They raised the minimum wage down there, and then California also just raised the minimum wage. I know that so not that much. The one thing I know about, and this was happening right before I went on maternity leave, so I can't speak to where it's at right now. So this was a year ago, but there was an effort to do organizing with people who sort recycling, because they're seriously underpaid and really exposed to really bad working environments. They're not unionized. There's it was the stories that I heard were kind of scary, people, sorting, recycling, and getting stabbed by needles and not getting time off and stuff like that. So that was one where I know they were trying to get a living wage. That's the best I can tell you right now, locally. Okay, thank you. Oh, right, Barbara.
So I remember when you brought this up when we were in that meeting, I went away and I was thinking about it. And I think, it's a great idea, but at the same time, I think that I'm wondering, well, a number of things, several questions. What's the criteria that you'll use to determine who gets loans? That's one question. Another question is, what do you have in place to sort of help people not default on loans. And then the third question is, why this and not jobs? You know, it's kind of answers itself, but I know the other one is a bigger, harder thing, but it's sort of like the impoverished poor person's approach. We're going to help you get some loans, but what they really need are jobs.
Yeah. And we want to see that too, and we've done work to support things not at the lead of them as we are in this work, but for instance, like the Oakland Army-based jobs campaign, we signed on to that and helped them promote the jobs there. And then, you know, through funding through the Reentry Innovations Grant, thinking about jobs for people who have convictions. That was an exciting grant to produce. But you're right. I mean, the heart of it is that people need money. We need to tackle that head on, and that would be, I think that more and more we can focus on that as this winds down. That's the beauty of this and having permanent staff now, is that we can be constantly planning. And so I invite you to push us in that direction, and I think that people would be really excited to go in that way. The other questions that you have were, how are we going to make sure people don't default?
Well,
I think
criteria.
Oh, the criteria.
Yeah.
So that's the kind of stuff that we're figuring out. We're lucky to be working with a person who runs what's called a community check cashing place in Fruitvale. I don't know if people have ever seen it, but it's a great nonprofit that does check cashing at, like, I forget, but basically the lowest you can do and not lose money. And they've been really good. So the loan loss rate that we're instructed to kind of use for our projections is between 10 and 15%, and his loan loss rate is 5%, which is like really low. I mean, yeah, that's low for an individual within all of the loans that they, you know. So anyways, so we're hoping to learn a little bit from him. How do you select the people? But we want it to not be so exclusionary that we're not helping the people that we wanted to help. So that's going to be part of the balance that we're trying to strike, and that's just how we're just at the beginning phases of that. The other question you had is the coaching, so the making sure that the financial institutions that we're working with actually provide some of the services that help people be successful. Yeah. And I'm sure there's a lot more to it to that. Our point person on that, her name is Tram, and she could talk to you a lot more about this if you're interested, or anybody's interested. Education, again, I'll just choose one pathway that was the first one my eyes fell on. You know, you need, in our current economy, it's really hard without an education to get a good job, and we know a good job leads to good health outcomes. So that at a very basic level, but there's many other pathways in which education impacts health. And so, okay, and so one of the issues that we've been working on is chronic absenteeism related to chronic health conditions. And actually, we first uncovered this issue when we were doing research for our criminal justice work group on some of the major issues. One of our staff people reached out to the district attorney's office, who said, another one of these instances, like, oh, thank you for coming to me about what you want to talk about, but what I want to talk to you about is the fact that in my truancy court, I keep seeing all these people who are here because they have untreated chronic health conditions. And so we ended up being able to assign through our chronic disease work and asthma start a case manager to go to the truancy court. I think it was like once a month or something like that. And so, and that's great, but this is dealing with people who are already in truancy court. So that's pretty far down the line. And so now what we've looked at is looking at how are school districts, how are or aren't they monitoring absences and tracking absences and looking at what they're coming from and making sure that they're providing the services to prevent those chronic absences. And so we're working with Hayward School District, 4 schools there. I can't remember, it's like Schaefer Park, and a few others. I don't know if anybody here remembers. If you're working in Hayward, we can get you that information. But looking at like how can you put in, and we're working really closely with CAPE staff here in developing tracking systems. So how can you develop your data and tracking systems to identify early on absences due to chronic disease? How do you then wrap services around it? What are the gaps in those services? And then at the end of this pilot, we're going to be making recommendations for policy and system change for the school districts to make sure that they can expand it beyond just those 4 schools, as well as carry it over to other school districts. And then there's other work that we've done in addition to this major project that I'm just going to keep, but I have to keep moving because in all these areas there's other work that we've done. I just don't have time to talk about all of it. And like I said, you know, our big goal for this next year is summarizing our findings coming out of this pilot and making those recommendations to other school districts and making sure that Hayward carries them forward. Okay, so housing and health. There's multiple pathways through which housing can impact health. One is, you know, if your housing is full of mold or something like that, you could have poor health outcomes. Or if you have no housing, again, the lack of stability, the lack of connections to your community and your neighbors, as well as just like maybe, you know, being in shelters or someplace where you're being exposed to stressful conditions, all have impacts for your health, implications for your health. Okay, so the primary focus of our housing work in the past year has been around code enforcement. I don't know if anybody here has ever tried to call code enforcement in the city of Oakland related to mold, but what you used to get was a hang-up, and then you got a redirection to a EPA line that then stopped existing. And so what we tried to do is we started working with code enforcement, trying to understand where they're coming from. Oh, sorry, I forgot to stop after the education one. Did people have anything they wanted to add to that or questions that they wanted to ask? Yeah, sorry about that, I'm sorry. Yeah.
Just a general question. One thing that I've been thinking about is about sustainability. Are you training people in the community to actually take over any projects down, you know, up and down? The different programs so that they are sustainable, so that you train people in the community to sort of take over.
Okay.
And you're not, you know, there to save, you know, people from the situation they're in.
Maybe this one will help answer that. I think that some of it was the health impact kind of assessment that they're asking us to do. A lot of times what groups are asking us to do is lend our institutional power, and so as a government agency, that's something that we have that we try and share by responding in a way to their requests. So not saying, here's our agenda, here's what we're going to do, we don't care about what you need, but to be there to say, here's what we can bring. We are credible health experts. That's what we're endowed to do by the fact that we exist as a public institution. But rather than just focusing on what we want to focus on, we're going to be there to back you up. I don't know how we could necessarily. The point is to share it, but we can't give it away because then it loses the institutional part of it. I don't know if I'm being very coherent. Does anyone else want to help me? Anyone else want to help answer that question?
I'm thinking more of it's empowering communities to sort of find solutions, give them some assistance, but then allow them to take over, and it's more sustainable that way versus, you know, with your small staff trying to.
Right.
Does that make
So
sense?
this is a good example. So I can highlight with the housing work, we're working really, really closely with tenants' rights groups. And so the way that we're approaching this is in partnership with them, and they're member-based, right? So they're people who work directly with members, who have the community organizers, who are training members to push this policy work. And then where we come in is we pull our institutional power and our analysis capacity to support what they're doing. Do you see what I'm saying? And so, yeah. Oh, okay. Did you want to say something?
Well, I was just thinking, like, it's still sort of abstract, so I think to put it in concrete terms,
Okay.
like, it may be helpful to say. So, for example, like, we're working with organizations that do door-to-door knocking, that do resident leadership trainings, that are training people who are being foreclosed on, to be able to go to city council meetings and talk about these issues. And so by working closely with these member-driven organizations, those people are also able to start using a health equity lens. And so sometimes even when we're not at the table, all these partners and residents are able to go to these city council meetings and not just say, hey, you're foreclosing on my home, but say, hey, you're foreclosing on my home and this is having a health impact on the community. So it's not like training in a formal sense where we have like, you know, come to our Place Matters training, but it's by working with these base building membership resident-driven organizations really closely and collaboratively. And like Tammy's done a lot of data work with people developing surveys where they say, no, the way you're wording it doesn't sound like the way we would say it. And then Tammy's able to say, okay, but if you want to have numerical data, you need to have a close-ended question. So there's a lot of transfer of knowledge back and forth. But I just wouldn't call it necessarily training. But it's definitely
That's what
Yeah.
I was talking
Yeah.
about.
Yeah, and
Sort of
so-
planting the seed
Yeah.
Right.
and allowing.
And there's examples of that in all the groups.
Yeah.
And it's definitely a key principle of the Place Matters initiative.
Like I was going to say, when we selected the work that we're going to, because as you can imagine, we were doing research in any one of these areas, we came up with like lists 60 long of things that we could do. And one of the criteria that we weighted most heavily, is one, is there an equity argument about it? So not just is this of general importance, but is this going to benefit low-income communities of color? And then the other one is there a membership-based organization working on it? Because they're building the power. None of this is going to happen without power, and they're building the power in communities, and that's their role. It's like an inside-outside. Yeah.
So we have 5 minutes left.
Okay.
Just go through what you can, and then people can ask questions.
Sorry. Okay. We're working on code enforcement issues. We are working really closely right now with our Asthma START program and the code enforcement officers, where we do actual case conferencing and look at like what are the problems that they're seeing, are they addressing the mold issues, and then taking things that we're learning in that kind of case conferencing and making policy and systems recommendations and thinking about new protocols that they can be implementing, and we're working with them to develop some protocols around mold. So now when you call, if you ever call with a client about mold, that is not you should get an actual response, and if you don't, call us. Again, where you live can expose you to toxins. Also, whether or not you have access to transportation can determine whether or not you can get to opportunities such as your job or your school or so forth. The major issue that we're working on in land use and transportation is integrating health tools into the planning process, so that you are making sure that as you plan, as you develop, you're promoting healthy community growth. And I think the best example for this is in the context of a crematorium that was that a community member gave in the context of a crematorium that was permitted in East Oakland, that it's easier to get a permit to burn thousands of bodies in East Oakland than it is to get a permit to build a community garden. So that gives you some idea of some of the problems in our planning process. One of the major things that we're doing is working with Supervisor Nate Miley, and Pam is the lead on this, around a health and wellness element for the unincorporated area that will really prioritize growth that's going to promote health outcomes in Ashland and Cherryland area. And then we're also working with community groups, a lot of them, again, base building, to look at developing tools for healthy planning in the city of Oakland. Okay. We have lots of partners. We're working on lots of advisory committees. We have a Facebook page, if it's not up here. You should become a fan if you're not already. It's awesome. I meet people who are like, oh, right, Place Matters. I know that from Facebook. It's a really well-maintained page by Kathy. And it just, because we cover so many issue areas, you're getting a lot of information about all of the social justice issues you care about all in one place. So I highly recommend it. And we do lots of presentations. And then this next year, one of the big things will be filling my job. So if you know people, please recommend that they apply. We're going to be putting out a big recruitment, and we're trying to, like the whole rest of the department, do more results-based accountability in this next year. And then connecting, ever increasing our connection to the various programs and services. Okay.
So before we give her a round of applause, if there's any one last question.
Hi, so we work a lot, this is in regards to the education on health. We work a lot with the Truancy Court and with OUSD and trying to help families get their kids to school on time. I think this is a really big problem in OUSD and Alameda County in general. One of the things that we are coming up against is the health of the parents. Actually is like either in decline, they suffer from a chronic disease. And so I work for a community-based organization that provides services specifically for kids, and so we're running up against the challenge of, well, how do we get the resources to actually help those parents get these kids on time? Are there other macro-based things that we can do to help these families get their kids to school
Right now, yeah. Yeah, a lot of things we're talking about are very long term, and I think that that's a really critical, urgent question. And I'm sure, you know, when we were going into this pilot, one of the things at least I was thinking about is like the kid and the point of decision making is like their control is very little. And so the parents, so like working with the parents and what are the issues that they're running up against and all the other things. So I'm sure that that's going to come up in this pilot, and I would just suggest that I connect you with the coordinator for that to see what comes out of it, if there's any recommendations that they can make. But I think also some of your knowledge will be really helpful to that group, so I want to make that connection.
I mean, especially like it's ridiculous how high the truancy rates for elementary kids. I mean, these aren't their fault.
No.
Like,
Yeah,
you know.
yeah, and their parents are coming up against really difficult challenges, so it's how can we support them, Yeah, so I will connect you with Anna Lee, and Darlene Fuji here is also really involved in that project. I saw your hand shoot up, Barbara, did you have a question?
Okay, I just find it, first of all, where do you get the information that says that, you know, parents have chronic diseases and that's why they can't get their kids to school?
We have case managers that work with the families that actually track which families have which needs. So we have contact with the families.
Okay. I just find that hard to believe that parents don't get their kids to school because the majority of them aren't getting their kids to school because they have chronic diseases.
There are some.
And I'm not saying that there aren't some, but I am saying that I think that it's more complicated than that low-hanging fruit, and I just hope that we can kind of begin to go to that complicated place.
And I think I want to make sure
and
that
that's
there's
all
some
I'm gonna
other
say.
questions that we get answered. I want to say though that clearly those chronic diseases didn't come from anywhere, from nowhere, and so we are trying to look at some of the root causes, and there's a lot more than what we could be doing that we've highlighted here today, and so hopefully there'll be more opportunities to talk about that. I saw your hand back there. Yeah.
A lot of the gaps or issues that people face about information or not having a wealth of information, or I hate microphones, a wealth of information at their fingertips, or being able to like figure out what, you know, economic resources best for them, or payday loans or whatever. And I wanted to know what type of gap analysis or capacity that you're doing in terms of like how many people in the county have been incarcerated but need a GED in terms of getting a job after that, and what's the capacity at the county level or the city level to educate or to provide the services so those people can get it. Because right now, even though we know that's a gap, we also don't have the capacity even when that gap exists, or we might have that capacity, but we don't. It seems like there's a disconnect.
Prioritize it. Yeah. I would say that's happening in different ways in different places. Like, so for instance, in our housing group, we found that a lot of tenants don't know their rights, and unless there becomes this great way to make sure that everybody always knows about their rights, having a system that completely relies on tenants knowing their rights when they're in a position where the landlords have more power is never going to work that well. So we're making recommendations where there's a balance between, you know, people being able to know their rights and stand up for themselves, and then the system designed in such a way that it favors those who have less power. And so one of the things that we're looking at is trying to figure out, are there ways that the government can proactively identify places that are in serious disrepair, and rather than relying on a tenant to make a call and the tenant's going to risk harassment for the landlord, go out and say, we know that this place is in disrepair and you must fix it. So that kind of thing in terms of information, and we can't meet all needs, we can prioritize the needs that are the biggest first. And then in terms of like the GED and incarceration, that's a great example of where there's not enough information about what are the educational needs of people who are coming out of the incarceration, and exactly when are we helping to meet those needs. We have people incarcerated, why aren't we helping to meet them way a long time before they are getting out of jail? So that's some of the stuff that we've discussed, and I would invite you to talk to some of the coordinators. I think that the major, bigger issue about how we prioritize resources is really critical, and it goes to how we make decisions at a budget level, not, you know, across government, and making equity a filter for that is definitely something that we'd like to see. And I know that at the state level, they talk about that in terms of health in all policies and making sure that we're making decisions in a way that promote health. And we would add equity to that. But that's a deep question, and it sounds like you'd be a great person to be working with on this work.
I just want to say that as people start to leave, if you're not on the newsletter or the Facebook page and want to get connected, you can see me. And the newsletter is only twice a year, so we're not spamming you a lot, but it is a great way to hear more about what's going on.
Thank you, everybody, for coming out and for taking your individual roles to help us to achieve health equity.